Everyone. My name is Mars, and I'm an overseas nurse currently working here in London. Specifically, I work as an educator, and I do help train overseas nurses to pass their OSCE. So I have nurses from the Philippines, kumusta kabayan? I have nurses from India as well, namaste, and also from Uganda, Nigeria, Kenya, among many others. So just recently, I received a couple of questions or messages from my friends back home, and they wanted to know what's OSCE is all about. Is it scary? What are involved in the exam? How long is the exam? How much is the cost? How many attempts am I allowed to take before my application will close? And what will happen if I pass the exam? So those are just some of the frequently asked questions that I receive from my friends. So I just decided to create this blog for them to understand what's OSCE is all about. And of course, at the same time, to share it as well to other nurses who are still deciding if they're gonna pursue their career here in London or not, and what are expected of them when they take the OSCE. So I'll try my best to speak in English. It's kind of hard. It's a struggle, nosebleed, but I'll try. So let's just see. Okay. So okay guys, so the objective structured clinical examination, or the OSCE, is based on UK pre-registration standards. So based on the one set by the NMC, which is the Nursing and Midwifery Council. It's basically equivalent to the Philippine Board of Nursing in the Philippines. It's also designed to assess your ability to competently apply your professional nursing or midwifery skills and knowledge in the UK. So just like in the Philippines, we are American based, but here in UK, they have a different way on how they do things. So you need to be mindful about that one, guys. You have also 3 months upon entering the UK from the employment start date, which is basically stated on your certificate of sponsorship to sit the OSCE. And so with that one as well, you have to be mindful that most trusts, especially here in central London, have their own training facilities on how they help their overseas nurses pass their OSCE, because OSCE is a return demonstration type of exam, guys. So you have to do IM medication, you have to do some subcut injection according to the UK standard. So it's really important and a must if you have your own training facilities wherein you can practice more, because there are also some other trusts who are just recruiting third parties, or they hire some agencies that can help you train on how you do the OSCE. Some of them 2 weeks intensive training, some are 3 weeks intensive training, but in my trust we have a 6 weeks program which I designed. So we do really discuss it, help these overseas nurses that are recruiting to really practice and do their best for them to prepare in the OSCE. So I think when you are applying for a job here in London or in UK, you need to ask your employer during your interview on how are they supporting their nurses when they come here to take up the OSCE. So that's not tip number 1, guys. Okay, so what is involved in the OSCE? So each candidate is expected to pass the 6 stations, which include 4 stations wherein you are given 15 minutes each, and we call it API. Social, pwede naman API. So let's say API. The first thing first is your assessment. So in assessment, guys, you are given additional 5 minutes to read your scenario, and then they can give you different kinds of scenarios. Of course, for example, it might be a patient's going for surgery, wherein you're expected to ask for consent. When was the last time? When is the last intake of food? Things like that one. And of course, we're also expected to do the vital signs monitoring of the patient. So those are just some of the aspects that you need to complete during your assessment. So I'm not gonna go into details with that one for now, and let's just do some basic overview. Then after completing your assessment, you're gonna proceed with planning. So in planning, guys, you are expected to create two nursing problems based on your assessment. So you have to be really keen, attentive on what kind of kinds of problems that you need to focus on your planning. And just remember, guys, that no matter how good is your planning, if you forget to sign and date and put your signature, then it's still a fail. So you have to be mindful of that one. And it's still 15 minutes, and then you're just gonna sit down in a chair and with a table, and there's no interaction with the patient as compared to your assessment. Then after completing your planning station, then you're gonna proceed to the implementation. So in implementation, basically you're just gonna give oral medications. So no IVTT, no inhaler, no subcut, or no IM medication injection, because those are other parts of the skill that you might be able to get on the exam. And make sure as well, guys, when you give medications, you need to explain, and not just explaining what medications are you giving, but also informing the patients of what are the possible side effects. And you need to sign your document after the patients, of course, have taken their medication. So do not sign it if you're still not able to give that medication to the patient. And in evaluation, guys, so evaluations basically, just remember that at this stage you need to have a complete handover of the patient to the other unit or to the other institution. So give them an idea what's happening with the patient, why are they being transferred to that unit or to that department. Okay, and of course, do not forget to put your name, the date of transfer, and of course your signature, because no matter how good is your evaluation document, if you haven't signed it, then it's still a fail. Then +2 stations, which could be one of the following. So you might be asked to do the BLS, or the basic life support. Before, it's 10 minutes, but now it's 8 minutes. You could either be expected to do the midstream urine collection and the urinalysis, wherein you need to do the urine dip, so to check for abnormalities in the urine, for example, ketone, glucose, positive in protein, leukocytes, nitrites. So yeah, so you have to take note of that one and explain the result to the patient. Also, it could either be the catheter sample of urine, which is 12 minutes, catheter removal for 12 minutes, peak flow, and administration of inhaled medications, which is also 12 minutes. Before, it's 15 minutes. Aseptic non-touch technique, or let's say the wound dressing. So it's a bit challenging, but you have to really be careful on how you're gonna maintain sterility when performing that procedure. IM injection, wherein you need to stretch the skin. Subcut injection, wherein you need to pinch the skin. So take note of those terms. And of course, the fluid balance, so the easier one, as long as you know how to compute. So what happens on the OSCE day? So guys, it's really advisable if you arrive on the testing center at least a day before your exam, because it will give you opportunity to explore the site or be familiar with the place. And there's one thing as well, you can also attend their open day. So testing centers have their open day, wherein candidate or those nurses who are about to take your OSCE can tour around the center. So they will show them the assessment station, the planning station, the implementation station, the evaluation station, their BLS room, and yeah, just to make yourself more comfortable perhaps on or to give you idea on your testing center. So you can also apply for that one online. So on your examination day guys, as a candidate, you are expected at least to arrive there 30 minutes to 1 hour prior to the scheduled time. So it will give you at least a chance to breathe perhaps. And of course, go straight to the reception for registration. The NMC ID check, so ensure that you're gonna bring all your documents, the one that you've submitted to the NMC, because if you fail to submit to bring some of your documents, it will also make some delays in the release of your result. So be mindful about that one. Although they might still allow you to take the exam in some circumstances, but just to avoid delays, so yeah, why not just bring everything. Also, your photos will be taken and ID badge will be given to you. After that one, you are then given with the briefing sheet, wherein the briefing sheet, and then what are expected, what need things to avoid, like your phones that need to be put in the locker, and then you need to sign that briefing sheet. After that one, when everything is sorted out, you are then escorted by the invigilator. Those are also part of the team handling the OSCE, to the API stations or skills area, because sometimes you might not really start with the API station, but other candidates might start with the skill station. So that's the two skill before they can start with the API station. So it depends basically on the number of overseas nurses or taking the exam. So yeah. Then of course, after completing the exam, usually it's between 2 to 3 hours. So ensure guys that you really take your breakfast or lunch before taking the exam. And then after completing the exam, of course, you are not allowed to talk, and then just you need to go home and then get all your stuff and then breathe. And then of course, you have to wait 3 to 5 working days for the result to be sent to your email. So yeah, so it's quick guys, it's very quick. So how much do I need to pay for OSCE? So first attempt guys, it will cost you 794. So other trusts like my trust, we do shoulder the first attempt of OSCE, so we will not reclaim it from the nurses. So other trusts will reclaim it over a period of 1 year, 6 months. So it depends on the agreement. So when you are still applying for to work here as a nurse, you can also ask your employer if what's the arrangement with this one. So take note of that one. And then for receipt, so you're gonna pay £397. So that's like 50%. Yeah, the 50%. And just take note, guys. If you fail in 1 to 4 stations, you're gonna pay the 50% cost, the receipt, so that's 397. But if you fail 5 to 6 stations, then of course you have to pay the 794 pounds. Just things to remember. Okay, if you fail on the first OSCE attempt, you have 2 more attempts before your application will be closed. Okay, the NMC as well require a minimum of 10 working days between the initial attempt and the first receipt, but it is also depends on the availability of slots, because the 3 testing centers, the Oxford Brookes, the Northampton University, and the Ulster University, have different rules about this one. So it really depends on the testing center. If still unsuccessful for the second attempt, candidates are required to wait 10 working days before taking the exam again for the third time. And if candidate fails the receipt, their NMC application will close. Also, candidate is not allowed to sit the exam again for a minimum of 6 months. So you are given 3 attempts to pass your OSCE. Then if you fail, then your application will close, and then you have to wait for a minimum of the 6 months before you can take it again. So it also depends on your hospital or your trust, if they still gonna keep you or they gonna release you. You only need to reset the stations that you failed. That's one good thing as well, because before on the when the OSCE started in 2015, you still have to really if you fail on one station, you have to repeat all. But now at least you only need to reset on the to reset on the station that you failed, just to complete the stations. The results will be released after 3 to 5 working days after the exam. So that's what I told you. So they will send it to your email. So it's scary, but what can we do? If you are not satisfied with your OSCE result, you can make an appeal. So candidates can receive a response within 20 working days. So yeah, but you are not the disadvantage of this one, of course, is you are not allowed to have a copy of the video that they've taken, taken, because that's their property. So although you can just wait for a positive result. And then to pass the OSCE, the candidate must achieve a pass score on every criterion. So it's just either pass or fail, guys. Pass or fail. If you pass, the NMC will contact you through your email, and you can now process your PIN. So it's easy. And then of course you have to pay the registration fee. I think it's £150 now. No, but at least it's okay. You get your PIN. And so the question is OSCE really hard? So I think basically it really depends on the person, because no matter how hard you practice, how hard you train yourself, but then if you let your fear and your anxiety dictates your entire performance, then of course you're gonna fail. So it's really important that you really taper down your anxiety, your nervousness. So if you know that is your struggle in achieving your goal in passing the OSCE, so you really need to find ways on how to overcome that anxiety. Because I do understand as well that some of the candidates are not so comfortable if someone is watching them, if someone is making a record or observations of what they're doing. But it's very understandable. But of course, we're here to pass the exam. So we need to overcome those fears. So I'm not gonna go into details for that one for now, but those are some of the tips that's really matter. And just remember, guys, believe you can. You are halfway there. So don't underestimate yourself that you cannot do it. So you are stronger. You are greater than you think. Remember that. So I'm just hoping, guys, that you find this video useful, and at least giving you some ideas on what to expect, no, in taking the OSCE. So if you have any questions, you can always put it in the comment box, and I'll try to answer. So if you have some topics that you want me to discuss, I can also try to make one for you. And I think that's all for now, and because I'm also running out of English. So thank you for watching, and goodbye.